Hi, I'm Nicole Tate, and welcome to episode 2 of Politics for Parents. This is a space to have nonpartisan discussions about issues that face parents in the US today. And hopefully, we can explore some issues and then talk about solutions to them, political solutions that you can take fairly easily to get involved and advocate for change and a better life for all of us and our families. So today, I have Rachel West, who is the Centering Implementation Director for the Centering Healthcare Institute. And I'm really excited to talk to Rachel today about their model for prenatal and postpartum care. But first, I will talk to you about the Centering Healthcare Institute just a little bit. So, from your website, your mission, as you guys describe it, is Centering Healthcare Institute imagines a U.S. healthcare system that offers not just medical interventions, but combats isolation and builds communities, empowers and educates parents and patients, and serves as a partner to connect the most vulnerable with resources that contribute to overall health. That's a lot. It's a bold mission, but it's a commendable one. And welcome. Thank you so much for taking the time to talk with us today, because I know you've got a big job and this is really busy. So I'd love to give you a chance to just introduce yourself quickly and your role at Centering Healthcare.
Yeah, so thanks for having me. As mentioned, my name is Rachel West, and I use she, her pronouns. I am based in St. Louis, Missouri, and I am a senior centering implementation advisor. So I've been working towards advancing the mission of group prenatal care, group healthcare for the past 5 or 6 years, and really excited to just share more about what we do.
Great. Well, thank you so much for joining us. My dog just entered the room, and he loves to chime in whenever I'm on camera. So if we hear from him, just excuse it. He's a very big part of our lives here in the house. So let's just get right into it, because this is a really different approach to healthcare. I think most of us are used to the standard practice of seeing an OBGYN, and then your baby is born, and then you're in the pediatric healthcare world. And so, mom still goes to some of her well visits while baby is going to visits very, very often. And I consider myself pretty well versed in healthcare policy just because it's something that I've experienced, I've been frustrated by, and I've researched on my own. But the Centering Healthcare model is just radically different from anything I've known. So I'd love you to just give us kind of the high level view of how it works, what its components are, so folks know really what we're talking about here.
Yeah, so in short, centering is group healthcare. So we currently have 3 models. The first is centering pregnancy, which is group prenatal care. We also have centering parenting, which are group well child visits. And finally, centering healthcare, which is group healthcare for an array of chronic health conditions like diabetes, weight management, Alzheimer's, cancer survivorship, etc. So regardless of the model, the core components are really the same. Centering visits are 90 minutes to 2 hours, and this is a billable healthcare visit, right? So this replaces their standard healthcare visit. In addition to having that health assessment component, the centering sessions include interactive learning as well as community building. The interactive learning really takes place throughout the entire session, where folks are engaged in peer sharing, peer learning. We have a saying that the wisdom comes from the group. And we know that when individuals are able to share their lived experiences and engage in peer sharing and learning, it can have a positive effect on health behavior change and in retention for participants. Community building is also, again, a core component, and this takes place throughout the session as well. Folks are getting more time with their providers, so they're building more community with their providers. They're building community with each other, all of the participants in the group. And beyond that, centering provides a really optimal forum for individuals to learn about community resources. So facilitators may bring in WIC. They may bring in financial literacy resources, childcare services, lactation consultants, etc. So there are really levels to that community building that takes place.
And just for anyone who's not kind of in the policy world, WIC is
Women, infant, and children, and so it offers an array of social services, nutritional resources, connecting folks with various resources as well.
perfect. Yeah. And that's, I mean, if you're in need of those services, it's a really important program to know about.
Right.
And I think it's, important for everyone to kind of think conceptually about the value of having that at your well visits, getting that wraparound kind of model. And, I think everyone can understand from your description, right, why this, I would refer to this as kind of revolutionary. And how did this start? I think, when you and I initially spoke, you had indicated that centering pregnancy kind of came before the centering parenting model. So I'd love to dive into that just a little bit, how that started, how you're scaling out the program.
Right. So yes, centering really began with our flagship model, centering pregnancy, in the early 1990s, when certified nurse midwife Sharon Schindler Rising decided it was time to reimagine prenatal care. In her delivery of prenatal care, she noticed that many of the questions participants were asking were the same questions that other people receiving care were asking, right? And so she was repeating herself throughout the day. She also noticed that she felt rushed during her visits and that folks were spending a significant amount of time in the waiting room. She felt like she couldn't really catch up throughout the day. And so her solution was this group-based model of prenatal care, where 8 to 12 individuals are able to receive their prenatal care simultaneously in a comfortable setting, a setting that promotes self-empowerment and just feels like a really supportive environment. So after the debut of centering pregnancy, folks really couldn't imagine going back to these traditional well child visits where they felt rushed, they had long wait times, they had no peer support. And from that, centering parenting was born. And this model was really conceptualized based on Sharon's interest in building out group dyad care for the entire family unit, right? Which is the foundation of these group well child visits. And really, since its inception, centering pregnancy has had significant reach. We have roughly 600 sites across the nation. We estimate serving roughly 50,000 families, and centering parenting is growing as well, with roughly 70 sites across the nation, in specifically 26 states. So there's been a lot of growth since the start of all of this.
I mean, that's wonderful to hear, just because it sounds like such a wonderful program. My only complaint is that I didn't have access to it when I was going through all this, because it really would have been helpful. And we talked a little bit about what it looks like when you are a pregnant woman going through pregnancy, and what the healthcare model looks like for you and what the experience is. So I'd love for you to kind of walk us through that a little bit, and really, I think not only the efficiency, but the community. I think the community aspect is so incredibly important, especially when we're talking about, I've talked about the isolation parents feel. And I know when I was a new mom, it was just terrifying and lonely. And I just really would have benefited from this type of service. So just walk us through it a little bit so people really kind of get what it's about.
Sure. So I'll walk us through centering pregnancy and we'll segue into parenting. But in pregnancy, when folks arrive for their centering prenatal visit, they immediately gather in a comfortable space and begin socializing with one another. So there's no wait time involved. Your session starts, say, at 9 a.m. You arrive at 9 a.m. and go right into your prenatal visit. So in those first 30 to 45 minutes, participants are actually taking and logging their own vitals, their weight, they're calculating their gestational age, and that helps to really promote health literacy and self-empowerment in the prenatal care visit. I mean, how many times do we go to a healthcare visit, they take our blood pressure, and they don't even tell us what it is, or if they did tell us, we don't really know what that
I have
reading.
no idea what it means. No idea.
Right. Right. So this really gives folks that ownership and again, improving health literacy. And they're logging it. So they're able to see the trajectory of, their vitals throughout their pregnancies. In that first 30 to 45 minutes, folks are also meeting independently with their healthcare provider in a semi-private area in the same room. So that really helps to demystify the healthcare experience. It normalizes healthcare practices. What happens to one person in an individualized visit happens to another, right? We're all getting these belly checks. And so that it also really helps to streamline the visit to ensure that everybody's able to, again, obtain their vitals and receive their health assessments in those first 30 to 45 minutes. So after that, participants are gathering in a group space in a circle, and they're discussing various health topics. They're sharing their experiences. They're soliciting resources. We have outlined curriculum, which includes an opening activity, a mindfulness exercise, interactive educational activities, as well as closing prompts. But we really encourage our site partners to customize the format of the sessions based on their patient population. And we encourage them to be culturally responsive through the various activities that they facilitate. So important to note that each session is co-facilitated, right? So we have a billable healthcare provider there for the entire group visit, as well as a staff facilitator who could take the role of a health educator, social worker, community health worker, doula, MA, etc. So the entire visit, all of the visits follow the typical prenatal care schedule outline.
Mhm.
So that would be, monthly sessions for the first 2 trimesters and then biweekly in that third trimester. So this does replace, again, their traditional care. Centering parenting is very similar. These groups include 6 to 8 parent-child dyads, and we start these sessions at about a month. Parents are involved in taking and logging their children's own vitals, and they also have that individualized time in a semi-private area with the provider. After all of that's taken care of, if babies are young enough, they go in the center of the circle and we all gather around and we talk about various health topics, parenting aspects, developmental milestones, and parenthood, just the journey of what parents are going through as they're navigating the postpartum period, going back to work, etc. And these visits follow the American Academy of Pediatrics Bright Future schedule, and children are also receiving their necessary vaccines at each visit.
Great. Well, thank you so much for that really concise overview of such a big program. And I just want to clarify a couple things. You
Mhm.
mentioned, the prenatal care follows all industry, like the typical standards, and the
Mhm.
postpartum care, the infant care follows the APA guidelines. So this is
Right.
standard care. And from what I know, this is also covered by health insurance, right?
Yes, so centering visits are billable healthcare visits and can be reimbursed by such. Um, Some states actually even offer enhanced reimbursement for centering pregnancy, which is exciting. We do always encourage our clinic partners to coordinate billing and coding practices for centering in accordance with their billing and compliance departments. But for the most part, centering visits are billable.
And I'm happy to segue from the centering parenting experience, and the aspect of parents being together and talking in a group setting, all of children of the same age, that cohort. Because I think one of the most heart-wrenching discussions I have with my friends who are new moms, and I've been a new mom. My daughter is now 7, so it's been a few years, but every time I meet someone with a new mom, it's the same thing that she goes through that I went through, which is that, maybe you're lucky to find like a breastfeeding I did at first, but a lot of those moms, like, they were either staying at home, they weren't going back to work right away, maybe they were just taking a leave off. I didn't have that option. So I went to like a couple visits at some library 15 minutes away. And it was great, but like it wasn't that often. And it was also just another thing I had to do on top of the well visits and everything else. So I lacked, and I know so many women lack, like, a a group of people that have babies at the same time going through the same thing, and it can be so lonely, not only for moms, but for dads too, so it's great you bring them all together, um, and, one of the things I experienced that I don't think was really clinical or clinically spoken about a lot, and I don't think it was a big focus, but I think your model addresses is postpartum depression and anxiety.
Mhm.
It's great that the national conversation has started to highlight this more, but I think because of the way our healthcare is delivered and a lot of different inefficiencies in the system, I think a lot is still falling through the cracks, which your program addresses. I went to every of my, newborn visits as well as my postpartum checkups with my OBGYN, and you get a questionnaire that's like, "Oh, are you having suicidal thoughts or thoughts of harming your baby? Do you cry all the time?" And of course, like those are kind of extreme places to be. It's great we're on the lookout for it, but in my mind, I'm like, "Well, I'm not that bad, so I must be fine. Like, it must be, like, normal, I must be okay." But I really was struggling. I was a mess when I was faced with going back to work, and also just the day-to-day anxiety of, like, "Am I doing anything right?" So I think your model really gives a space for people to kind of express that and do a little bit more of a comprehensive screening, analysis, discussion, and education, and I'd love to hear a little bit about, any data you guys have on the outcomes of, people like myself, because I know there are so many women having those same types of thoughts and probably could use some help, but they don't even realize it.
First, I want to just thank you for sharing your experience. And I know that that period can be exceptionally vulnerable. And even with new conversations, greater awareness, more resourcing around postpartum mental health, and more screening opportunities, a number of parents have unmet needs. And centering parenting is really designed to combine care for parents in addition to care for children. And many of the sessions, especially the earlier sessions, are designed to center postpartum wellness and balancing, your new and growing family. We've seen some pretty incredible benefits related to perinatal mental health. You're asking a little bit about the data, but of course, we've seen an increase in maternal depression screenings being both completed as well as documented. We have greater retention and attendance overall for centering visits, and so that really helps to ensure that we have those routine check-ins taking place. Uh, we've also seen specifically a study looking at adolescent physical and psychological well-being that showed a positive impact of centering pregnancy. And then we had another 2021 study that looked at a population of folks who were Latinx immigrants. And they noted that because they had more time with their healthcare provider, there was greater opportunity for screening and education around these psychosocial topics, such as postpartum depression. So it really gave them a better opportunity. They also noted that the social connections that they formed and learning from their peers' lived experiences were really supportive of the postnatal journey. And of course, anecdotally, I have heard numerous providers say that they get to know their patients more. Actually sitting for, an hour and a half, 2 hours with your patients, you're going to learn so much more about their journey, their lived experiences, their mental and physical health than you are in these rushed 5 to 10 minute visits, right? And even what peers share with each other is a learning opportunity for providers, and peers are often more vulnerable and transparent with each other than they may be with providers who they see in a position of power. So definitely I've heard some positive feedback from providers around this.
Yeah, I mean, that's just what I would expect because, these are my friends, right? Having children, they know that, you know, um, I've been through something similar, and having been through it, I can spot when someone's not okay. And just having somebody else in the trenches with you to say, "Are you okay? Like, are
Right.
you really," and having that time with your provider. You're not just checking a questionnaire, like, no, I'm not suicidal. No, I don't cry 24/7. Like, okay, you're fine. Go on. Like, I mean, I just think it's like a really great component. And another thing that I think is super valuable about your model is a focus on equity.
Mhm.
Specifically as it pertains to improving maternal health outcomes for women of color.
Mhm.
Nationally, we see atrocious disparities in our healthcare system and outcomes of Black women, right? I mean, we can do so much better. So I'd love to talk about Centering Healthcare Institute's work and on improving these outcomes and your focus there.
I really appreciate you uplifting this question. And, to tie it back to our mission, centering is our goal is to improve health, transform care, and disrupt inequitable systems through the implementation of the centering group model. And I want to note a couple of ways that I really feel like our model fulfills this mission. So, first, our focus is on person-centered care, right? Rather than, people receiving care being just a number, we want providers to be able to see them as people, right? With unique lived experiences, backgrounds, goals, health decisions, motivations, etc. So centering really helps to provide person-centered care by, again, participants having longer time spent with their healthcare provider, engaging in more abundant conversation, participants taking their own vitals. This promotes that self-empowerment, right, and gives them a sense of ownership over their healthcare. And participants are also able to engage in peer sharing and learning in a way that really helps them to communicate, again, their unique goals and values, which of course we know influences healthcare. Centering is also designed to be inclusive, and it offers a really remarkable arena for providers to deliver culturally responsive care. And centering sessions are designed to be inclusive in a number of ways. First, all groups are conducted in a circle. We all sit in a circle. There's no head of a circle, right? And that really helps to disrupt inequitable power dynamics. The number of participants also outweighs the number of healthcare providers. So the power is with, the individuals receiving the care. We also encourage all of our site partners to establish group guidelines in this space, which helps to make sure everybody's voice is heard in an equitable manner as they navigate their prenatal care visits. And providers really have this opportune forum to get to know their participants and their lived experience, as I mentioned, which helps them to provide culturally congruent care. In addition to those kind of facets of centering that inherently get at our mission, I want to uplift that centering has actually been proven to reduce preterm birth rates and has shown a flattening of racial disparities for participants enrolled in centering. We have seen studies have shown an overall preterm birth rate for participants who are Black as virtually the same as participants who are white, which is, a really significant finding. In numerous studies and peer-reviewed articles, centering has also demonstrated improved health outcomes, including, again, a 33 to 47% decreased risk of preterm birth, more consistent attendance at visits, greater readiness for labor and delivery, increased breastfeeding, chest feeding, etc. And the last thing I want to say about this question, I would be remiss to move on from this question without noting that there is a significant role that racism plays in the disparities of maternal health outcomes, especially for Black birthing people. Institutionalized as well as structural racism, in addition to the chronic stress that folks are feeling from repeated exposure to discrimination, both in healthcare settings and outside of healthcare settings, really impacts their birth experiences and their health outcomes. So, in order to effectively reduce racial and ethnic health disparities, healthcare professionals must first explicitly acknowledge the role that racism plays in healthcare and in health outcomes. And at Centering, we really work to create facilitation workshops, guides, consulting services, and resources that address inequities in healthcare and address social drivers of health. We encourage providers to offer equitable opportunities for healthcare consumers to access evidence-based healthcare. We also encourage providers to acknowledge their own bias and to acknowledge incidences of interpersonal racism that takes place, every day in their healthcare delivery. We encourage, the offering of culturally responsive care, and above everything, we really strive to make sure that participants are centered in the centering space and that their unique, valid, lived experiences are at the center of the care that they're receiving.
Well, thank you for that. I think, I don't know, I've made some efforts, to try to educate myself and become more, consciously aware of implicit biases and different aspects of racism that I've participated in unknowingly.
Mhm.
It's hard, and I think, not only healthcare providers, but everyone could benefit from really taking a hard look at that. So I appreciate your focus on that. Um, and, I think also, one of the values of your model is that there is a diverse group of people. I mean, these are just people who seem the same healthcare provider. They're
Yeah.
not like choosing their cohort of people. So it's a good opportunity to maybe have people from diverse backgrounds together, and build a village that is not just people who look like you who are in your bubble. And I think there's tremendous value in that. um, everyone talks about, oh, it takes a village to raise a child. I think I read that book by Hillary Clinton in, like, I don't know, like fifth grade or something, like before I could ever possibly embrace that role concept. But with centering parenting, I think you guys really are like helping people to build that village. And when we spoke initially, you shared with me a really amazing story of how, that village formed in one of your practices and was able to help a new mom when she was in a time of need. So if you could, I'd love to hear, that story or another example of really what this looks like, in impacting people's lives and helping uplift others.
Yeah, this story, has always just stuck with me as a way to really exemplify the community building aspect of centering. And um, in this particular centering pregnancy group, there was a pregnant individual who was expecting twins. She was one of the only participants in the group without a support person or a partner. So she was, on this pregnancy and parenting journey on her own. And she was also significantly younger than the rest of the group participants. As you mentioned, there's a lot of there can be a lot of diversity in the centering set groups. So throughout the sessions, she just continued to mention that she really needed a twin pack and play. The pack and play is like where babies can play, they can lay down, but one designed for twins.
Pack and play is critical. Yeah, critical.
But she really didn't have the resources to obtain the twin pack and play on her own. So as the group moved through the sessions towards the last session, all of the dads and the partners in the group actually gathered and went out and bought her the twin pack and play and gave it to her during one of those last sessions. So you can imagine there was so much gratitude in the space. And again, for me, it just really uplifted that this sense of community. And I think that significantly impacts any perinatal journey. There's also numerous, accounts of this in terms of centering parenting. I know many centering participants that continue to keep in touch with each other via text message, group chat for 10 plus years. I recently heard that a group gathered for, they would gather routinely on birthdays, and it was the 10th birthday that they would all gather together. So not only is this establishing community during, the first 2 years of life, but even beyond that, which is pretty neat.
Yeah, I mean, that's remarkable, because especially in a society today where I think people are more disconnected than ever,
Mhm.
um, I am somebody who is habitually terrible at keeping up with, like, my own friends and seeing people. I have one friend, Cindy, if you're listening, hi. We do need to get the kids together for a play date. So, the fact that, like, these people are forming these bonds and really sticking together is beneficial to all of them. I'm sure their
Mhm.
children are friends. I mean, they're basically extended family at this point.
Mhm.
So that really speaks to the value of this model, the impact it can make on people's lives. Any of us who've had children know, like, the amount of stuff to buy is insane. And in the past few years since I had my babies, inflation's ticked up. It's all just more expensive. So I think that's just a wonderful story. I love to hear things like that. And I think other people of means would love to be able to participate. So many people I know want to give back and they want to have impact and they'd love to know how to do that. So it's a really great opportunity from all sides. So having said that, I'm sure people listening now would love to know, where do I sign up? How can I access these services? How can I participate? If there isn't a center in their area, then maybe, like, could they start one? So how can they become involved? What can they do to participate or expand what you guys are doing in the model?
First, thank you for featuring us. We're really hoping to make centering a household name. We want this to really be a routine way that people receive healthcare, because we know it is a better healthcare experience. So, a couple ways I think that listeners could get involved is ask your provider to implement centering. Right, if you really like your OB or midwife or your pediatrician, ask them about centering. They can learn more about our model and implement various implementation resources that we offer on our website, which is centeringhealthcare.org. Also follow our Instagram at Centering Health. You can learn a lot about centering happenings, various initiatives, and you can see if there's a centering, parenting, or pregnancy site in your area, also on that same website under the locations tab. So see if there's one nearby. You might be surprised to know it's in your community already. And then lastly, of course, you can help us expand group prenatal care, group well child visits, group health care by donating via the link on our website. And again, we really just want to make centering a household name. So the more that you talk about it, share about it, it means a lot to us and has a big impact. So thank you.
Well, thank you for taking the time to have this conversation today. And more importantly, just for the essential services you're providing, because when I learned of what you guys are doing and I heard about this model from you, I thought firsthand about how transformative it would have been for me to have access to that when I was a new mom. And I know so many new parents today that feel like they're kind of fighting this uphill battle. And I think one of the things too that we do that damages that whole dynamic, sets people further back, is I think we tend to joke about it too. I mean, we joke about, oh, it's the sleepless nights and, the spit up all over your clothes and, oh yeah, running on the hamster wheel, trying to get to work and do this. And, like, I feel like we've normalized kind of like laughing it all off. And it's fine to, like, find humor in these situations and laugh through the pain really of this experience. But I do think that at the same time, we really need to think seriously about how to alleviate pressures wherever we can. And you guys have really found a way to do that. So hopefully, we get some traction here and we get a lot of people interested in this program. And, if anyone would like to get more information, we do have a Substack that goes along with this podcast, Politics for Parents. So find us on the Substack so we can send you the show notes. You can get resources and links as a follow-up to this episode. You can also get more information and get on our mailing list through amplifyinc.org. Amplify is the public affairs firm based in Newark, New Jersey that, this whole podcast is a project of. So, I really thank you, Rachel, and thank everyone for listening. I encourage anyone listening not to turn this off and just go back to your day, but take a minute to think about next steps. If this resonates with you, think about what you can do to support the mission. Like Rachel said, you can go to their website, follow them on Instagram, stay engaged, and take a minute to figure out how you're going to use this information to make your communities better, and help your family and other families access better healthcare. Because I think, if we all work together, we can make a better world, and we really should try to do so. So thank you, Rachel. Thank you, everybody. And, stay tuned for the next episode.